It's one of the most popular cosmetic surgery procedures, but tonight a local plastic surgeon has a warning about breast implants she wants women to hear. COVID has, of course, dominated the health and medical news over the last 2 years.
But last fall marked a major milestone for an army of women who've been fighting for an acceptance and understanding of breast implant illness. Devin is here tonight with the story of a local doctor in that fight who is putting principle ahead of profit.
Yeah, Karen, last fall, the Food and Drug Administration finally adopted a policy on breast implants that many women have been demanding. Women wanting implants now have to be warned about the possibility of problems that might come after the implants are in. The medical community has struggled to recognize BII as it's known. Some doctors still insist it isn't a real condition, but one local plastic surgeon is going beyond the warning. Dr. Amy DeRosa is a little unusual as plastic surgeons go. She has probably removed twice as many breast implants as she's put in.
These are different sizing.
Breast implants are an extremely popular elective surgery, and generally it goes really well. 90% of the women who get implants say they've met or exceeded their expectations. It all seems great, except when it's not.
Nobody can diagnose me, and we're all, thought to be kind of crazy. Everything's in your head because your labs are all negative, at least mine were.
2 years ago, I sat down with a group of women at the home of former Local 4 traffic reporter Tracy Gary. They had all been through severe health crises that couldn't be explained. Hair loss, fatigue, muscle aches, brain fog, which led to depression, which can lead to...
Do you think you ever got suicidal?
Oh yeah, I would text him, I feel like going into the lake and drowning.
For these women, it all changed when they had their breast implants removed. Despite the fact that for so long, the medical community insisted breast implant illness was not a thing.
I had suicidal depression so bad. That is all gone.
They all told me that when the implants came out, they got their lives back. It was 6 or 7 years ago, a woman came to Dr. Amy DeRosa with the same set of varied, intense symptoms. DeRosa wasn't sure there was a connection between the symptoms and implants either, until she took them out.
That first patient, we took her to surgery. We did our procedure, including removing capsules, of course. And her symptoms started going away right before my eyes as I was seeing her in the post-op period.
And it kept happening. She developed a reputation. Sure, any doctor can remove breast implants, but DeRosa was among those who insist on a more complicated procedure to remove not just the implant, but the capsule that develops around it.
There's a lot of patients presented to the office and they have this guilt in themselves. And I made a bad decision. What was I thinking? Why did I do this to myself? And I would say to them, I did it as well. There's lots of
Yes,
women
she
that
too had implants. And slowly, Dr. DeRosa felt the symptoms her patients were describing were hitting closer to home.
I started relating more and more to them as far as some of their symptoms would go. And it was this common relating to them that made me realize that, I feel like I potentially might be experiencing them as well.
She too had her implants removed, and she too got her life back.
All of this led you to a rather extraordinary decision about your own practice then.
It did, absolutely. So I decided ethically, after treating so many of these patients and seeing the outcomes and improvement, that I ethically didn't feel comfortable in doing cosmetic augmentations.
Understand, breast implants are a very popular, and it must be said, very profitable procedure. But she says it was too ethically incongruous to remove implants in one operating room only to walk into another and put a set in. But don't worry, she says the rewards are many.
Thank you so much. You've given me my life back. I can't tell you how many times I've heard it, and it's the most wonderful thing to hear. So I get lots of hugs, and it's always fun at the very end. So.
Now, this all remains extremely controversial. Just since the promos started airing for this story, I've heard from several plastic surgeons who are still very skeptical of the existence of breast implant illness. Still another directed me to a recent study showing no real difference in the kind of implant removal. So even at that level, this is going to continue to be a contentious and heated fight, even with the FDA's new warnings in place, Karen.
And Devin, now you've covered this issue extensively, and you've talked to women who want to see breast implants done away with completely. Is that Dr. DeRosa's position?
It is not, Karen. She doesn't want to go that far, and that's why she and a number of colleagues of hers are focused on creating a kind of test, a screening test, that might help indicate which women are more likely to suffer from problems from implants than others. But no, that doesn't exist yet.
Never see a doctor really take a stand like that. Very
interesting, isn't it? Yeah.
Thank you, Devin.